Hi, I'm Hannah and this is Advice from Akota, and today we're going over something called passive range of motion. So it's a post-stroke intervention that is designed to promote movement, maintain joint health, and manage edema through that affected arm. So this is specifically designed for arm flaccidity. So this means that there's no voluntary control in this arm, typically seen as the first stage in stroke recovery, where we are just trying to maintain that joint health and preparation for movement. So begin with me here in our self-passive range of motion. So if you're able to perform these movements by yourself, that's great. Let's go through them at least 2 to 3 times daily, keeping our joints nice and healthy and hopefully starting to re-engage some movement through this arm. So we'll work from the shoulder down to our digits. Our first movement will be supporting through our elbow. And what will happen is our flaccid arm will be supported by our unaffected arm. We'll be grabbing here at the elbow, and what we're doing is just lifting this arm up into a 90-degree angle and gently dropping back down. Your arm might be very heavy, and that's normal, but we're trying to get up to this 90-degree angle. You'll need this movement for dressing, and you'll do this about 10 to 12 times, 2 to 3 times daily. Next, we'll move into something called rocking the baby. So exactly what it sounds like. You're using your unaffected arm to rock your affected arm back and forth, getting that nice shoulder abduction and adduction. Again, 10 to 12 repetitions, 2 to 3 times daily. Once we've moved through those, we will slide our hand down, supporting ourselves at the wrist here, and we'll work on our hand to mouth movement pattern. So it's a more functional movement pattern than just straight elbow flexion and extension. You're going to do this 10 to 12 repetitions, again, a couple times daily. So you're just bringing exactly like the movement sounds, your hand up to your mouth, like you're feeding yourself. So after we've worked through that, you're going to flip your hand and you're going to try to grasp in between each of your fingers, and we're going to go onto our elbow movement of pronation and supination. So we want to flip our palm to face the ceiling and our palm to face the floor, a movement that's often overlooked, but we use daily very often as we're grabbing things, brushing our hair, brushing our teeth, opening things, putting things away. 10 to 12 repetitions of this. Next, we'll go into our wrist movements. So we'll begin with flexion of the wrist and extension of the wrist. Being very careful here. This is one of the stretches that people tend to try to overstretch, over push the wrist back, but you're just trying to stay within maybe these 90-degree angles or whatever feels comfortable to you, about 10 to 12 repetitions here. Our other wrist movement is called radial and ulnar deviation. So it's our wave. So we are going to pretend like we're waving to the side, a weird wave pattern here. But we're bending our wrist to the left and to the right. And we're doing that 10 to 12 times. After this, you'll need a table, and we'll work through our finger mobility. So pause here and get a table. So now that we're at our table, we'll gently take our arm, place our hand palm up, and we'll begin with just a little massage, extending our fingers, getting them through that complete extension, our finger extension. After that, we are going to range each digit individually, holding onto the knuckles or the fingertips, just bending the finger in towards the palm and back out. So you'll go through each of your fingers individually 10 to 12 times. And we'll also include your thumb in this. And then after you've ranged your digits those 10 to 12 times, we'll put a little bit more focus on our thumb, which is a little more mobile. So we'll want to work on this L shape, and then bringing our thumb back towards our palm, it back into that L shape, being very careful not to overstretch here either. It's just very gentle. And then we can even support our thumb through our knuckle and do a few circles in both directions. Our thumb is actually one of the joints that tends to hurt people the most, so give some little extra love to your thumb. Our next section is dedicated to the caregivers of people recovering post-stroke. So if you're unable to perform this self-passive range of motion, or you're looking for something to help your loved one after post-stroke, then this section is for you. Now, if you're a caregiver, let's talk about performing passive range of motion on your loved one or the person you are caring for. We will begin with shoulder mobility, where we will stabilize through the elbow and maintain pressure on the shoulder as we lift the arm up into shoulder flexion, not lifting past that 90-degree angle. And we'll do 10 to 12 repetitions. Then we will readjust our position, supporting through the elbow and maintaining pressure through that shoulder as we bring the arm out to the side in shoulder abduction and adduction for 10 to 12 repetitions. Next, we'll move into a hand-to-mouth movement pattern. So we'll support the wrist and we'll support the elbow and move through that hand-to-mouth movement pattern 10 to 12 repetitions. Following that, we'll support the wrist and the hand, and we'll move into supination and pronation, and we'll do that for 10 to 12 repetitions. Next, we'll flatten the hand, we'll get the fingers in good finger extension, and then go through finger flexion and extension, 10 to 12 reps per fingers. You can do them all 4 digits at the same time, and then the thumb separately, making sure you move that thumb through that nice L shape to get a good stretch to prepare for that hand movement. Thank you for joining me on this tutorial for passive range of motion post-stroke recovery. Join me every week for a new tutorial video covering a wide range of conditions, and be sure to like and subscribe. See you next time.